Let us discuss the physiology of circulation. We're going to be starting, of course, with blood pressure, which is the main thing that we think of when we discuss the physiology of circulation. The idea of blood pressure is that you want to have enough pressure to bring blood all the way to the tissues of the body, and then you want to have the ability to continue a small amount of pressure through to the other side of those tissues to where it can return eventually to the heart. So, of course, your blood pressure is going to be highest closest to your heart. Let's talk about hypotension. Hypotension is what we call low blood pressure. So low blood pressure could be a normal situation, it could be a very healthy situation, or it could be due to poor circulation or poor nutrition, especially in the elderly, so it must be monitored closely. Hypotension is considered anything lower than 90/60. Hypertension, of course, is a much greater issue, the one that we deal with in our society all the time. Hypertension is high blood pressure. The heart, in this case, is forced to pump blood against greater resistance that is present in the arteries. And if hypertension is persistent, it can weaken the myocardium over time. It can damage the arterial walls. It can also damage the kidneys. So typically, it depends on other factors. But typically, hypertension is defined as 140/90 or higher. And hypertension can be caused by various factors. In this picture, so what are we talking about with all these numbers? We are looking at the systolic and diastolic pressures. And the nice thing is that you've already had systole defined as the contraction of the ventricles of the heart, and diastole defined as the relaxation of the ventricles of the heart. And the basic idea here is that your ventricles, as they squeeze blood out, there's sort of a surge of blood that comes out during a heartbeat and surges blood into the arteries, and it sort of makes its way through, and during that surge, the pressure gets higher. And when the ventricles are relaxed, the pressures against those artery walls gets lesser, and that's why you have the two numbers. Okay, so let's talk about neural regulation. The idea behind neural regulation is this is a short-term control of blood pressure, and there's two purposes. One of the purposes of neural regulation is to alter blood distribution to different parts of the body depending on the specific demands of the tissue at that time. And you have cardiac output and resistance at work. And sometimes they're enhanced at the same time, but basically the heart decides where blood is supposed to go, and so you decide how much blood to output depending on the status of the body at the time. And then the other side of neural regulation of blood pressure is to maintain adequate pressure in general by altering the blood vessel diameter in general. So remember that vasomotor tone, where the sympathetic nervous system is always kind of in charge, even at rest. It's always sort of in charge of the blood vessels and keeps them slightly constricted at all times. So the natural state of arteries is to be mildly constricted. So the question is, how does the brain decide? So first of all, I should say that control of neural regulation is going to be in the medulla of the brainstem. So when you think of the brainstem, we have all these cranial nerves going into that region, and we allow for that control center to be present right there in the medulla. So that's where your blood pressure is controlled. And when you're trying to decide what is an appropriate blood pressure, you can make very fast changes based on the status of the body, because there's several types of sensors around the body that control these things. So one of the inputs is called baroreceptors. Baroreceptors will sense an artery stretch, and when the artery is stretched, you want to signal that the blood pressure should be lowered, should be declining. So these guys are found in the carotid sinuses, in the aortic arch, and in the larger artery walls. So arteries that are very close to the heart will tend to have these baroreceptors that sense stretch and then signal back to the medulla to reduce blood pressure. Next, we have chemoreceptors. Chemoreceptors will sense fast changes in the oxygen levels or in blood pH, which is an indirect measure of carbon dioxide levels. and they are able to cause vasoconstrictions and vasodilations depending on what is needed. And again, chemoreceptors are going to be found in the aortic arch. They're also going to be found in the large neck arteries. Some chemoreceptors are actually going to be found in the spinal cord, monitoring the cerebrospinal fluid, because these chemicals can change very quickly in the blood, and that change can be transmitted very quickly into the CSF. And then just so you know, you also have higher brain centers such as the hypothalamus that are able to, again, alter what's going on in the medulla, which in turn will alter what's going on with neural regulation of blood pressure. And this would be called, if you have a fight or flight response, for example, you might want to quickly constrict those blood vessels and increase your blood pressure just temporarily. All right, and then the longer term, so neural regulation is one side of the picture. The other side of the picture is what we call renal regulation, and so we're looking directly at the kidneys. And there's actually only one goal, really. Like the whole goal of renal regulation, for the most part, with just a little bit of variation to that, but for the most part, what the renal regulation is in control of is maintaining blood volume as close to 5 liters as possible. So you want to make sure that you're decreasing blood volume when it's appropriate, or increasing blood volume as it's appropriate. This is a longer term change. So remember that neural regulation is quite short term and fast. Renal regulation will take longer to get going, but also will last longer. Kidneys act in 2 ways: directly by increasing filtrates from the kidney, and indirectly by the renin, angiotensin 1, angiotensin 2 system, where you have control over, for example, the thirst mechanism, aldosterone, ADH, and to some extent over the vasoconstriction of the blood vessels. So there is some of that vasoconstriction here as well.